So I've recommended for you that you do this stool testing. Now, the reason I've recommended this testing is that this is going to allow me to see the presence of any type of infections or anything that's going on in the gastrointestinal tract that might be disrupting your overall health. Doing this stool testing is the only way we're going to be able to see that information. Now, in the kit that you were given, there's a box, and in that box you're going to find, most importantly, some instructions here. And in this instruction, if you forget or need to go back and reference anything that I'm going to discuss in this video with you, this is going to be where you're going to find that information. This is going to be a 6-step process of how we're going to do this, and I'm going to walk you through that 6-step process. So the first thing you're going to do is, when it comes to having a bowel movement, when you have your bowel movement, and also let me say this in the preparation, you don't need to stop any of your probiotics, you don't need to stop any of your digestive support, but when it comes to collecting this, you're actually going to collect your stool sample in this container. Now, once you have your sample in this container, the next thing that you're going to want to pick up is going to be this vial. Now, one of the things that you'll find in this vial, when you open it up, you'll notice on the cap, attached to the cap, there's a little scoop on that cap. That scoop is what's going to allow you to place your stool into this container. It is important to make sure that when you fill this up, you'll notice on here that there's a red line. It's important to make sure that you've got this container filled up to at least that red line, and then once it's filled up, invert the container a couple of times to make sure that the liquid that you're seeing in here is actually mixing with the stool contents. Now, upon finishing that, you're going to have a bag that's also in the container, and you're going to take your vial and you're going to place it in the bag and just roll it up in the bag. And once it's rolled up in the bag, you'll set that aside for a moment, because the next thing you want to be able to do, or the next thing you want to do is, and we're going to highlight this for you, so you'll see this highlighted on your requisition form, is there's an area here where you're going to put the collection date. Now, it is very important that you put that collection date on there. Don't worry about the rest of the information that's on the form. We've already taken care of that and filled that out for you. So your responsibility here is to make sure that you've got this highlighted area filled out. Now, you're going to take this, fold this back up along with the sample that you had, and you're going to take both of these and you're going to place those back into the box that you had. So place those in the box, and then once you get that placed in, go ahead and close that up, and then the next thing you're going to do is take this and place it into a prepaid FedEx clinical bag. Go ahead and take that, pull the sticky adhesion off and seal that up, and there's a couple of things that you can do with this once you've got this completed. You can either call FedEx to come pick this up directly from your location, or you can take it to a FedEx drop-off center. Either one are going to be completely adequate to do. So again, that's going to be the collection process for your stool sample. And again, this is an insight for us to be able to see exactly what's going on in your gastrointestinal tract. And remember, your GI tract is the window to the rest of your body. If your GI tract is not healthy, none of the rest of your body can be healthy.